Welcome back, everyone. Welcome back to another edition of Health Class. Today's edition is quite special because we are now starting the men's health topics. Today, we will be discussing about erectile dysfunction. Actually, there's a lot of men's sexual health concerns, but the two most common concerns are erectile dysfunction and premature ejaculation. So tonight, we will be discussing one of them, which is erectile dysfunction. It is actually common. It is the most common sexual health dysfunction condition amongst men. And I'll be discussing about the causes, treatment, and everything relating to erectile dysfunction. So keep on watching. Women has sexual health concerns, and also men. However, men's sexual health concerns are not commonly talked about as compared to women's sexual health concerns. One of the main reasons is that men are afraid to move forward and talk about their sexual health concerns. This is a serious condition. This is a serious discussion, and I am requiring your maturity and understanding about this topic because it is a very serious topic amongst men. So what is erectile dysfunction? Erectile dysfunction is the inability to get an erection and to maintain an erection. There's a lot of causes why men get erectile dysfunction or they are unable to get an erection anymore. We have the three main common causative factors why men suffer from erectile dysfunction. Number one is lifestyle factors. Number two, we have psychological or mental health factors. And number three, we have this what we call health comorbidities. Let's go to number one most common causative factor. Lifestyle. Lifestyle. Anything that you can relate to lifestyle. It could be smoking cigarettes, drug use, alcohol consumption, weight management or being obese or being overweight, not enough sleep, unhealthy diets, anything under the sun that you can relate to lifestyle. Number two is psychological or mental health. Anxiety, depression are the two most common psychological factors. We have performance anxiety. If a person is diagnosed of a mental health condition and is taking mental health medications. Stress, whether it's financial, personal, work stress, family stress, relationship issues, whether it's past or present. It could be that the couple is undergoing a divorce, property settlement, child custody, anything that you can relate to relationship issues, past or present. Low self-esteem, and then we have these what we call health comorbidities. What do you mean by health comorbidities? Health comorbidities is if a person is suffering from another condition, particularly a chronic or chronic conditions. One of the most common causative health condition is diabetes. They said diabetes is a mother disease. Once your diabetes is uncontrolled, your sugar level is uncontrolled, it could lead to a few medical health conditions. And one of them is men's sexual dysfunction. It could be erectile dysfunction or premature ejaculation. Gout, Peyronie's syndrome. Peyronie's syndrome relates to the anatomy of the penis, whether there is something wrong with the structure of the penis, it's curved, it's not straight, there's lumps. That's Peyronie's syndrome. High in cholesterol, high blood pressure, any heart-related diseases, pelvis and back issues, especially if the person had surgeries in the past in the pelvis and the back area. Cancer, especially prostate and bladder cancer, benign prostate, hypertrophy or enlargement of the prostate, because one of the effective treatment for this type of cancers is radiation, and radiation can damage the veins supplying or carrying blood to the penis in order for the penis to have a good erection. And the common question that is asked to me is, can we consider age as a causative factor? Anyone can be affected by erectile dysfunction. I have a very young patient in the past, as young as 16, 17, 18 years old. And I've got the oldest patient so far as old as 82 years old. So anyone can be affected by this men's sexual health dysfunction called erectile dysfunction. The main reason being is that it is linked to the blockage of blood vessels in older men. So the veins carrying and supplying blood to the penis in order for the penis to be erect are blocked. The blood couldn't get through. The circulation is very poor. This is what we call atherosclerosis plus diabetes. Diabetes slows down the blood circulation. So what is the pathophysiology or the mechanism of erection? When blood fills two chambers in the penis known as the corpora cavernosa, an erection occurs. This happens when a man gets excited. This causes the penis to expand and harden or stiffen. This process is triggered by nerve impulses from the brain and genital area. Anything that interferes with these impulses or restricts blood flow to the penis can cause erectile dysfunction. So this is the corpora cavernosa. When a man gets excited, there's a lot of impulses happening in the brain and genital area. So this part of the penis will be filled with a lot of blood. There will be a sudden gush of blood to this area of the penis. So we've discussed the causative factors of erectile dysfunction earlier. The other cause that the medical practitioner needs to consider as well, if the person is taking medication that can cause erectile dysfunction. We have anti-androgens. Anti-androgens are used to treat prostate cancer. We have blood pressure medications. We also have sedatives. Sedative medications can cause a person to become sometimes a little bit dizzy. We also have antidepressants, appetite suppressants, also medications, to name a few. So what are the signs and symptoms? If the erections are too soft, erection lasting very short, and if the man is unable to keep or maintain that erection for a long period of time and not able to have a good erection. Just a trivia, a lot of people ask me why men usually get erection early in the morning. Well, it's because of testosterone. Testosterone is a male hormone. So in the morning, the testosterone levels in men are higher than any time of the day. That's why without any excitement, without the man getting excited, testosterone goes up in the morning, which causes erection. Now we're going to be discussing about the treatment of erectile dysfunction. The main treatment of erectile dysfunction is fixing the underlying causes of the condition. Remember what I've discussed with you earlier about the causes of erectile dysfunction? Those causes need to be fixed in order for the erectile dysfunction to be reversed. What are some of those important treatments? Lifestyle modification. If you are smoking, you need to start thinking about quitting smoking or smoking cessation. There's a lot of treatments out there. Most of them are over-the-counter treatments to help you quit or stop smoking safely or in a healthy way. If you're drinking alcohol, you need to start thinking about limiting your alcohol consumption or stopping alcohol consumption. And then again, when it comes to alcohol and drug treatments, there's a lot of options that you can take to assist you in those treatments in a safe way. Now remember, when it comes to lifestyle, it is individual. Example, if you're overweight or obese and there's a lot of weight that you need to lose, then it could take a little bit longer for you to do that in order for you to reach that healthy weight range for yourself. If it's a smoking cessation, it could be longer for you. It depends upon your commitment and your dedication to undergo that pathway of treatment. It could be shorter for some, it could be longer for a few people. Medications are temporary fix to this treatment. Remember, the ultimate treatment of erectile dysfunction and any other men's sexual dysfunction conditions such as premature ejaculation is improving your lifestyle and making sure that your mental health well-being is 100%. Now, medications. What are some of these medications? You've already heard about Viagra. Viagra is one of those treatment options when it comes to medication that is very common and popular these days. We also have other medications such as tadalafil, vardenafil, and there's a lot of compounded medications or mixed medications out there. When I say compounded or mixed medication, that means two medications for one condition combined into one physical tablet. There are medications out there for erectile dysfunction such as sildenafil, which is commonly known as Viagra as a brand name, and vardenafil combined into one physical tablet, or it could be Viagra and tadalafil combined into one physical tablet. We also have devices such as vacuums and pumps. We also have injectables wherein the person needs to be injecting the medication into his penis. Surgery. This will be the last treatment option if all other options are exhausted, such as there's no oral medications working, the devices are not working, then the next step would be surgery. Implants will be put in. Some of those options such as silicone rod or inflatable devices. Obviously, we should not forget psychosexual counseling because, like what I said, it is important for a person to have a good mental health well-being. It is important for that person, whether he is undergoing a treatment, medication treatment or not, to engage himself in a psychological or psychosexual counseling. Why? Because it is important for a man to understand his current sexual health and to be given that valuable education about sex and sexual health in general, especially to those people who are experiencing some stress in life, whether it's work stress, financial stress, relationship stress, for those people who have anxiety or depression, for those people who have performance anxiety. Remember what I told you before, the mechanism of erection. There are impulses going around. When a man gets excited, there will be a lot of impulse activity in the brain and the genital area. Now, if a man has mental health concerns, then it is impossible to have those impulse activity from happening. Now, probably you've heard about this too. Kegel's exercise or pelvic floor exercises, especially to those women who's delivered babies in the past. Why? Because Kegel's exercise is actually recommended to pregnant women in order for the pelvis to be strong so that they will have a smooth and effective delivery of the baby. Kegel's exercise can be applied to men as well. Why? Remember what I told you before with the causative factors? If the pelvis and the back area are damaged, then it can lead to erectile dysfunction as well. Our pelvis area, our back area are very important in order for a man to achieve a good erection. This is the basic of erectile dysfunction. I would encourage men out there that if you experience erectile dysfunction, please talk to your doctor. Don't be ashamed. Don't be afraid because you're a man and you need to be masculine. No, this condition is actually happening. It is not so common amongst people because a lot of men don't want to talk about it because they are afraid that a lot of people would know. Talk to your doctor about it so that an effective management plan and treatment plan can be put in place. Talk to your partner about it. And for the ladies with partners suffering from erectile dysfunction, you need to work with him. You need to understand him and offer support. These men with erectile dysfunction needs your support, needs your understanding. That's it, guys. Thank you for watching. I'm gonna be discussing about premature ejaculation next time, and maybe I'm gonna make a video about some common sexual or sex myths that we have out in the community, and we're gonna try to present facts and try to correct some of those myths that are not true. Thank you for watching. Stay safe and be healthy.